On April 2, 2026, U.S. and Israeli bombardment targeted the Pasteur Institute of Iran, a historic medical research center in the heart of Tehran. Right up until the strikes, the campus was a quiet, tree-lined sanctuary dedicated to international research. The strikes reduced the central courtyard to a landscape of tangled metal and pulverized concrete. The World Health Organization immediately reported that the facility was so severely compromised that it could no longer deliver health services to the public. To understand the weight of that loss, we have to look past the physical wreckage and examine the century of science that was housed here. The timeline of this institution began in 1920. Established following the First World War, it was the oldest and most prestigious medical research center in the Middle East. Collaboration with the Pasteur Institute in Paris began on land donated specifically for this purpose by the Iranian aristocrat Abdul Hussein Mirza Farman. Its founding mission was to manufacture the serums and vaccines required to fight off deadly, contagious outbreaks of smallpox, plague, and cholera. By focusing on preventing infectious diseases, the institute built the region's first organized disease control system. From its inception, the facility was designed to preserve human life and share scientific knowledge across borders. This workforce of 1,300 staff and 300 PhD researchers operated across 28 distinct scientific departments at the time of the attack. These figures represent 40,000 national vaccinations and treatments provided annually for endemic threats like rabies, tetanus, and hepatitis B. This global footprint includes 22 countries where the Institute's BCG vaccine has immunized 238 million children. The Institute maintained its role in the global Pasteur network, acting as a hub for studying emerging infectious diseases and aiding in COVID-19 vaccine development. A medical network reaching 22 nations and hundreds of millions of patients is a critical piece of global health infrastructure. On April 2nd, the airstrikes brought a sudden halt to those diagnostic and vaccine production lines. The World Health Organization has verified over 20 separate attacks on healthcare facilities across Iran since early March. The target list includes the Tawfiq Daru complex, a pharmaceutical center that produced essential medicines for cancer and multiple sclerosis. These strikes have resulted in the deaths of frontline health workers and members of the Iranian Red Crescent Society. The bombing of the Pasteur Institute follows a pattern of systematic dismantling of civilian healthcare across the country. Political scientist Vali Nasr analyzed the deeper intent behind destroying a century-old scientific institution. Nasr points out that attacking this specific facility bypasses tactical military objectives. It serves as an assault on the physical evidence of Iran's scientific modernization. Political leaders had previously threatened to bomb the nation back to the Stone Age. Erasing medical heritage and disease control capabilities achieves exactly that regression. It took 106 years of painstaking global collaboration to build this biomedical titan, and a single day of bombardment to reduce it to ash. The debris on the campus represents a severed timeline for the millions who depended on this research. Their history and future survival are the true casualties of April 2nd.